Joining me now is Dr. Amulya Yadav of Penn State University. Dr. Yadav, great to see you. Thanks for joining us on the program this morning.
Thank you for having me, Jeffrey. It's a pleasure to be here.
It's great to see you, Doctor. I was kind of half-heartedly joking that based on your research, it looks like I may never need my primary care physician again because people are accessing GPT, ChatGPT, and able to most of the time, get accurate answers.
Well, yeah, I mean, it depends on how do we quantify the word most of the times, right? So our research shows that basically on average across many different contemporary large language models, that includes ChatGPT, that includes Gemini from Google, that includes LLaMA, the LLaMA series of models from Meta. Across all of these models, we collected patient queries that were provided by members of the Penn State community. And across all those queries that we were able to collect from the Penn State community, it seems to be the case that LLMs were able to provide a valid answer, right? And we've defined, we don't need to go into the formality of it, but basically validity corresponds more or less with accuracy. So LLMs were able to provide an accurate answer to 76% of of all the cases or all the queries that were put in front of these large language models, right? So 3 out of every 4 answers, more or less, were that the LLMs generated were correct. And this notion of correctness was adjudged by Penn State certified physicians. So we had a panel of 9 physicians from the Penn State School of College of Medicine, and they were the ones who were adjudicating whether the answers that were generated by language models, whether they were accurate or inaccurate, whether they were harmful or not harmful, whether they were empathetic or not, and so on and so forth. Yeah.
Oh, I'm sorry to interrupt you. I was going to ask, what was the reaction? First, let's ask you your reaction. Were you surprised at all that based on the adjudication by the actually certified medical practitioners that this information actually coming out of the large language models was correct? Did that surprise you, doctor?
So personally, it surprised me, but the fact that it did surprise me should have little value because I'm not a medical expert, right? I'm a computer scientist, and therefore, right? I mean, the fact that it did surprise me, my prior assumption was that language models would do terrible at this job, right? Would not be able to answer health queries, would not have the nuance, would not be able to handle corner cases, right? Would always, because that is the sort of notion that we've come to expect from when patients use Google to self-diagnose, right? If you ever go to Google, there are these horror stories that I'm sure all of us have lived through. When we go to Google and say we have headache, and Google tells us, well, this could be a sign of stomach cancer, right? And or something crazy, right? So that is the sort of baseline from where my mental model was operating, and therefore I had anticipated that language models would be similarly bad in their answers. But so personally, I was surprised that they did as well as they did. The other side of it is it also remains to be so. I mean, maybe you'll get to it, but I just want to touch upon this.
Sure, go ahead.
Is that 76%? It seems like a good number, but if you compare that to rates of misdiagnosis amongst human physicians, right? And this is based off a quick Google search that I did online. There were several different websites which seemed reasonably genuine, that said that the rates of misdiagnosis amongst human doctors is approximately 10% or 11%, right? So compared to that, it seems that large language models are still not as accurate as compared to a human physician, right? So 76% is great. It seems to be a lot better than getting a self-diagnosis from Google, right? But is it enough for us to completely cancel our medical insurances and just get a ChatGPT Pro subscription because that's all that we need for a doctor? I don't think we're there yet, or at least based on our limited data set, it doesn't seem to be that way.
Doctor, are there certain maladies or certain ailments where the large language model does better? I would imagine that without diagnostics, it couldn't tell me if I had high blood pressure or heart disease, but it probably could give me information about, as you said, a headache or some kind of common ailment. So does it do better in certain areas versus others?
So that's a good question. I think let's talk about where it does poorly. And you're very right in touching about areas where you need diagnosis or you need test results to be able to make a diagnosis, right? On those sorts of issues or cases, certainly ChatGPT or language models does not do as well as compared to some other categories. Yet another category where we saw that it was not doing as well is dermatology, and that seems to be very reasonable. It's something that we expect, because you can imagine that most dermatological queries require people uploading a picture of their skin, right? And by now, there's a good amount of consensus amongst the research community that vision-based language models, that is, language models that understand images, that reason with images, that don't work as well as compared to language models that only work with text queries. So therefore, anytime you have to upload pictures of skin and you need to ask a language model, what do you think this is? Is this eczema? Is this something else? Right? It is understandable that they're not doing as well as compared to queries where there need not be an image-based component. Right? The third category where it did not do as well was mental health queries. And this has a lot of implications, because there's a lot of investment that is going into setting up startups and infrastructure for LLMs for mental health or for therapy, etc. Right? And based on our limited sample size, it seemed to be the case that language models were not generating answers. They were very there's a good amount of research that shows that language models are very sycophantic, right? Which is not always what a human counselor is supposed to do. They're not always supposed to agree with the patient, right? Whereas language models have this tendency that they have a innate desire of wanting to agree with whatever the human asks it to do, right? I'm sure you've read of articles online about, thankfully rare cases where somebody asked uh, a language model about wanting to end their life, and the language model
Yeah.
says yes, if I were in your position, I'd do the same thing. You obviously you're in a very tough position. So it is because of the sycophancy that language models in our data set were also found to be lacking in generating responses to mental health queries. In
So
terms of doing well, queries regarding general medical concerns, right? Things that you would take to a primary care doctor. For example, I have a common cold symptoms. I have symptoms of influenza, etc. These sorts of queries, language models was doing very well. There's also something called differential diagnosis, DDR, which is something that language models were doing very well. So yeah, that's what we found.
So would you say that maybe this is a tool that is complementary
Mhm.
to visiting the doctor, that it's not just like Dr. Dougal. Dr. Google wasn't a replacement for the physician.
Mhm.
This isn't necessarily a replacement for the physician, but it is a complement and actually can be used as a tool to
Mhm.
help the physician refines things, so they can be used by the physician to help a patient. Is that where this is kind of going, doctor?
Absolutely. I think so. That there are many different possible use cases of this. So certainly, you're absolutely right that it should not be. We don't see, or we hope that society does not see these tools as replacements for human doctors, because at this point of time, they're not, right? There are use cases, genuine use cases, where there are statistics from the World Health Organization that almost half of the world's population does not have access to good quality healthcare, right? And so for that half of the world's population who does not have access to a doctor, even though they may have the money, even or maybe they don't even have the money to go see a doctor for whatever reason, uh, having access to a medical chatbot that can give them an answer that is correct 76% of the times is better than not having a doctor at all. So absolutely, if you're in that half of the population and you don't have access to a doctor, this is a wonderful tool for you to have, right? Even in situations where you do have access to good quality medical care, in that case also it should only be seen as a complement, right? I completely agree that the outputs of these language models are best kept, or they would be of much more value to physicians, because I think by now we all understand, even in America, there's a huge mismatch between supply and demand. The demand for healthcare is far greater than the supply of healthcare. There are long waiting times at primary care doctors, and so on and so forth. So this tool can really speed up or make the work of physicians more efficient, so that they can use their limited high quality time to see more patients without sacrificing the quality that they provide to us. Right. So certainly, that's a good way of thinking about it.
Let me ask you, let me end on the ethical aspects of this. I would imagine that the American Medical Association, some of the other, federal, state regulatory entities, you'd probably want to have some guardrails put in place. Is that something that you think makes sense? And not only the doctor using it as a tool, but you mentioned the suicide debate or conversation that is, I recall some of these horrible cases, but do we need a framework? Is there a need for a framework to put some constraints around these large language models when it comes to the medical aspects of things?
Absolutely, absolutely. We certainly need guardrails, a framework for guardrails. We need regulation, etc. But it is important to understand that any attempt at creating a framework or guardrails. So, by the way, guardrails do exist in today's LLMs, right? I mean, the horror cases that we talked about, where an LLM uh, encouraged a person to commit self harm, those are rare cases, primarily because of the existence of guardrails, right? And the other thing to notice is, just because of the huge diversity of questions or ways in which questions can be asked to LLMs, it's always going to be a cat and mouse game, right? So you can come up with a set of guardrails, and they'll work well for the intended use cases. But soon enough, there's going to be another set of users who are going to ask a question in a slightly different way, and that guardrail is not going to be able to accommodate that. There's a huge line of research in what we refer to as adversarial or jailbreaking of LLMs, right? Which specifically focuses on, how do you get LLMs to say what they're not supposed to say? How do you get an LLM to bypass? How do you bypass the guardrails that have been put in place inside an LLM? So it's always going to be a cat and mouse game. I think the more important or the more useful way of thinking about it is that it is very important. So certainly framework is needed, we need regulation, and that framework and regulation needs to be adaptive. It needs to keep on evolving, because these LLMs are continuously evolving, right? But more importantly, it is important for users, both the patients and for doctors, to be aware that these language models are not to be looked at as replacements, right? Whatever they generate is not supposed to be, it is not necessary. We need to make ourselves aware. And the more we listen to this message, the more it gets internalized, that whatever comes out of these models is not gospel truth, right? It need not be viewed as that, right? Whatever comes out of it needs to be taken with a grain of salt. The fact that an LLM may tell you that you might be suffering from cancer does not need to account for anything, right? So therefore, to have our wits about us as we navigate this technology and use it for our benefit, right? I would be completely okay with a human being using an LLM for self-diagnosis, receiving an unfavorable diagnosis, but to have that emotional maturity that this is just a language model, right? This is not a doctor, right? But because it's saying this to me, maybe I should go and see an actual doctor, a human doctor, to check this out. That would be a mature way of doing, of using this technology for good, as opposed to freaking out, thinking that I'm about to, something bad is about to happen to my life. So it's very important for us to have this awareness, much more than the regulation part of it.
Yeah, well, it's like any tool. You have to understand it, you have to be educated about it, and you have to have the right perspective in using the tool. Dr. Yadav, great to see you. Great research. Thank you so much for joining us, and we look forward to having you back on the program again very soon, sir.
Thank you, Jeffrey. Thank you so much.
Well, thanks for watching, and don't forget, we're back again tomorrow morning with another great expert and another great topic. You can tune in right here Monday through Sunday at 7:30 a.m. Eastern Time. And don't forget to subscribe to our daily newsletter, The Morning Pulse, for all the news in one place, delivered directly to your email box. Check it out at our website.